Well, as pandemic restrictions are eased in parts of Ontario, health officials wondering why the province can safely balance health and the economy during this third wave. Joining me now to talk about the possible impact of businesses reopening is infectious disease epidemiologist and a member of Ontario's COVID Science Advisory Table, Dr. Ashley Chewett. Good morning to you.
Good morning.
So I want to begin here. Sid and I were just talking about what it looked like this weekend. First weekend of spring, a lot of people out and about, and a lot of people, saying, hey, I'm outdoors, I'm safe. Please tell me where that stands right now and where you stand with that when it comes to not masking and groups still gathering.
So I think in general that idea is correct. Being outdoors is much lower risk than being indoors. And the reason for that is because the main way that COVID transmits is via air. So it's an airborne infectious disease. And being outdoors, we have really good ventilation. So, in general, this idea that doing activities outdoors is lower risk than indoors is correct. Having said that, if you're up close in somebody's face, it's still likely that you can transmit infection or just transmit to them if they are also, if you're in close contact. So I think one of the easiest ways to think about this in terms of transmission risk is if someone's smoking near you, being outdoors is a good way to sort of reduce the risk that you breathe in their smoke. But if you're up close in their face, you can still breathe in their smoke. And so in those situations, you would still want to wear a mask, even though you are outdoors.
Dr. Chewett, sitting on the Science Advisory Table, tell me a little bit about what you're looking at and how you are advising the province.
Sure. So I'm actually not on the science table. I'm on the modeling table, which does contribute to the science table. But, the things that feed into those decisions in terms of, how these recommendations are made and how these decisions are made, I think at this point, the really sort of pressing thing are these variants of concern. So we have these more transmissible variants. And when you look at the epidemic curves for them in particular, we see that they're increasing at a rate that's much quicker than what we're seeing with the original variants of the virus. And so despite the fact that, right now we're in a period where we've entered the third wave, we see increasing cases, we're seeing more of these variants of concern. And we know that those variants are associated not only with easier transmission, so they're easier to spread from one person to the other, but they're also associated with more severe disease. So we're seeing more young people who have these variants who are ending up in hospital, and the variants are associated with a higher mortality rate. So more people are dying with them. So this is, I think, the most concerning thing that's going on right now in the pandemic in Ontario.
Doctor, when every guest that we have on, when we talk about COVID-19, I do ask the same question because we do get different answers. And when it comes to this race with vaccinations between these variants of concern and these new cases that are popping up, where do you think we stand in this race?
I think we're losing the race in the sense that, the virus just spreads so much faster than we can vaccinate. But I think it's helpful to think about this less as a race and more about a game. And so we need to be strategic. The virus is going to spread more quickly than we can vaccinate, but we can be strategic with our vaccinations. And we have other tools beyond just vaccines to try and ultimately win this game of strategy. And so that involves these other public health restrictions that we have in place.
When you talk about the strategy, so let's talk about those who are getting vaccinated in phase 1, now into phase 2. We're looking at 75 and older. Do you think that there's a category of the population that should be looked at next that maybe hasn't been considered? We've heard a number of people say, taxi drivers, grocery store workers, the people who work in the restaurant industry should be right at the top of the list. What do you think?
Yeah, I mean, it's a really difficult question. I think, when you talk about the prioritization, there are a number of groups that you would want to be prioritized first. Age is the obvious one, and we're doing that right now. People with underlying medical conditions that make them more vulnerable to having a severe outcome if they do get infected. And then, essential workers. I think that's really important because those are the people who are at the front lines who are bearing most of the risk. And so, in an ideal world where we had unlimited vaccine supply, I think, we would have a number of different groups that we would all move to the front of the line, but unfortunately we can't. But I do think those conversations are really important because, as we start opening up more, we're going to have to, move beyond the age prioritization and make sure that the people that we're asking the most of in terms of them, continuing to be out and about and exposed to risk, to make sure that they feel protected and valued.
Indeed. Dr. Ashley Chewit, thank you so much for your time today. Appreciate it.
Right. Thank you so much.
Your time right now is 7:11 this Monday morning. Let's join the gang, see what they're talking about. Hey, guys.